Thank you, Mr. Chairman, and thank you for holding this hearing, and I want to thank all of the witnesses and the panels that have taken time out to be here today. Mr. Chairman, I'm not sure quite what to focus on this morning. All we know about the bill or all that we don't know about the bill, but in either sense, it's very disturbing. And let me begin with what we don't know. We don't know how much CBO says it will cost or how it will be paid for. And hopefully everybody can see page 162 of the bill on the TV screens. Now, I know a picture is worth 1,000 words, but I think that picture may be worth well over $1 trillion. The bill says other revenue raisers are to be provided. When will these tax increases be provided? When will the American public get to know how much this trip to the doctor will cost them? Those details aren't unimportant. If you're shopping for a car, even I have to admit that a Ferrari looks pretty good next to a Ford until you see the price tag. A 6-bedroom mansion on the waterfront looks pretty good next to a modest 3-bedroom ranch until you see the price tag. We need to know the price tag of this bill if we're to do our jobs properly, and that is to write a bill our country can afford that will guarantee every American has access to affordable, quality health care. Just this morning, I received an independent, nonpartisan analysis of the bill. I know I said this picture was well over $1 trillion, but this report makes it clear that I really don't have much future in appraising because this bill is actually worth $3.5 trillion. And let me repeat that for everyone here, especially the members who've not been given any information on the cost. An independent, nonpartisan analysis says this bill costs $3.5 trillion, and I ask that a copy of this report by HIS Network be included in the record. Now, that's a staggering figure, even in Washington. Equally staggering are some of the ideas we've heard floating around about how to pay for this bill, such as new taxes on employer-sponsored health benefits, new taxes on sugared soft drinks, additional taxes on alcohol that'll turn Joe Six-Pack into Joe Four-Pack, a new national sales tax, new taxes on American businesses competing worldwide, and higher Medicare taxes. Those are pretty darn scary in and of themselves, but what has me in shock is the fact that those taxes won't even come close to covering $3.5 trillion in new federal government spending. And it's clear that if we move forward with this $3.5 trillion bill and with any of those taxes, whatever hope remained that the President would keep his word not to tax families earning less than $250,000 will be quickly erased. The President has also promised repeatedly that Americans who have and like their insurance will be able to keep it. Now, I know he's getting pressured to back off that statement. I'd hope both Republicans and Democrats on this committee would help him keep that pledge. But the analysis we received this morning says this bill would cause 64 million Americans to lose their coverage. 64 million. That means 1 out of every 3 Americans under the age of 65 would lose their current private health coverage. We need to strengthen and improve our health care system, not destroy it. No matter what comes out of this hearing, unanswered will be several critical questions. How much will you tax and who will pay those quote-unquote other revenues? What will be the impact on family budgets? What will be the impact on employees and employers and on those looking for work? What about the economy as a whole? I'm disappointed that this information isn't before us, since it's impossible to make a thorough evaluation of the bill without it. Now to what we do know. It creates a government-run plan that reimburses at Medicare rates, which will force millions of Americans to lose their current health care plan. There are absolutely no prohibitions on new government-run plan or government programs like Medicare or Medicaid from using cost-effectiveness research to impose delays or denials of access to life-saving treatments for patients. And just the new taxes and penalties on employers that we have already seen will force 4.7 million Americans to lose their job. Now, those aren't my numbers or my analysis. That's what you get when you plug the taxes associated with an employer mandate into the economic models developed by Dr. Christina Romer, the chair of the President's Council of Economic Advisors, and Jared Bernstein, who is in the office of the Vice President. What does this leave us with? In short, a bill in which the solution costs more than the problem. And health care reform in which millions of Americans lose their insurance, lose access to treatment, and maybe even their job. This is what happens when legislation of this nature is written in secret by a few behind closed doors without the input of members on both sides of the aisle, not to mention the families and businesses it will affect. I have heard even members of this committee have raised their concerns about the way this bill was written. So have Blue Dogs in a written letter, and so have House Republicans. This painfully reminds me of the stimulus bill. But as important as it was, we were just talking about money then. This time, we're talking about people's health, about their lives. We cannot get it wrong again. The President was right when he said health care reform should not be a Democrat issue or a Republican issue, but an American issue. And as you know, last week, Republicans outlined a summary of what we believe successful health care reform should focus on: affordability, accessibility, and availability of quality health care for all Americans. There are a number of areas where we could reach bipartisan agreement. I and the Republican members of this committee stand ready to meet and work with you to get this bill right, and I hope we can do that soon. And with that, I yield back the balance of my time.